Hi, this is Carine over at Michigan Oculofacial Specialists. We're going to be discussing your surgery today and talk pre-op, post-op recovery, basically what to expect. The first thing when you get into the room, I'll confirm your surgical date as well as what procedure you're having done, where, and then with the surgeon who's going to be performing the surgery. At this point, the first thing I typically do is we'll check your med list, just make sure that we're both on the same page, that the list is up to date. If you're on any prescription blood thinners or a baby aspirin, we will typically request a clearance form from your primary or your cardiologist, and they will let us know how many days that we can safely hold that medication. Again, I will check that day to make sure that they completed the clearance and that all of us are on the same page of how many days to hold it. 10 days prior to your surgery, it's really important that you hold any vitamins or supplements. These include CoQ10, fish oil, your multivitamin, as well as any NSAIDs. So think ibuprofen, Advil, Motrin, Aleve, those all have blood thinning properties in it. So again, 10 days prior, we do recommend you just taking a Tylenol or acetaminophen for a headache or a backache per se. In terms of the latest and greatest weight loss medications or diabetic medications, we do have a list like this in your surgical packet that specifies every single medication and how many days to hold it prior. It is important to make sure you review this medication list in case you are on any of those injectables or pills for diabetes or weight loss. At that point, I will make sure to review your visual field. That is going to be that test that you had done for your surgery if it was insurance-based. This will make sure that we have all of our ducks in a row for insurance approving that it is a functional or medical necessary surgery, as well as some of the physicians like to have old photos in your chart. About 10 to 20 years ago is typically what we look for, and I will make sure that that is in your chart as well. Now, prior to surgery, really the only homework again is making sure to stop all those vitamins and supplements, NSAIDs, and then any prescription medications that we talked about. The nurse will call you a day or two prior to surgery to let you know what time to arrive, whether it be at Trevista or Beaumont. The nurse will go over that medication list and then also tell you not to eat or drink anything after a certain time, depending on what time your case is boarded for. So please look out for that call from them about 24 to 48 hours before the surgery, again, letting you know what time to arrive and when to stop eating or drinking. It is important as well that morning of not to chew any gum. A lot of people forget that one, and it is important not to chew any gum before your surgery. Moving on from there, I will say it's important if you do have any Botox or filler on board, especially with Botox in the forehead or crow's feet or your 11 lines, we do want you to hold that 3 months prior to surgery. So it's to make sure that that's all worn off and what we're seeing is truly you. After the visual field review and the old photos, I will go over what is needed for surgery. So in your packet, there are 2 important sheets, each one for the physicians. Dr. Pearce's looks like this, along with your grocery shopping list here at the bottom, as well as this really important color sheet that basically has everything written down that I'm about to express today. And for Dr. Handler, same thing, just it looks a little different, but again, this is in your surgical packet, 2 important sheets, that QR code with his grocery shopping list at the bottom, as well as your post-op instructions listed here, okay? So we'll get into it. I'll just make sure that, for their exam, when you came for the consult, if they ordered any blood work or imaging, we'll make sure that that's completed and negative and that it is okay to proceed. The day of the surgery, you will need a driver. It is done under a little IV medication. It is a light sedation. I tell people it's like a twilight. So if you've had cataract surgery, for example, it's very similar. Some people will hear us talking, some people are snoring. It really just depends how receptive you are to the medication. There is one thing I like to point out. If you are having ptosis surgery, we do sit you up during this procedure. This is because everyone looks like Sleeping Beauty laying down, and then when we go to sit you up, we basically want to see those lids droop with gravity, making sure that they're as symmetrical as possible. Dr. Pearce and Dr. Handler might have to sit you up 2-3 times. I don't want you to fret about that. They're just trying to give you the best surgical outcome. Again, that's truly where the art of medicine comes into play. We're talking millimeters that they're dealing with to try to get those lid heights as symmetrical as possible, okay? After surgery, there is no patches or bandages. You'll be able to see, read, get around just fine. Really, the only reason you need a driver that day is because of the sedation. Both procedures of a blepharoplasty or external ptosis repair, you will have stitches running from this inside corner along the crease just past the tail of the brow. It is one long running stitch that you will see. For Dr. Pearce, he will want you to actually use a little swipe of Vaseline. So you're going to use a little swipe of Vaseline along the incision line just once a day for about 5 days. That again is just to hopefully stop any bleeding or scabbing going on, providing just a little bit of a protective barrier along that suture line. After the 5 days of Vaseline, you will stop. Then he'll want you to use some artificial teardrops, just like Dr. Handler, 4 times a day into both eyes. Refresh or Sustain are usually the brands that he recommends. Now, Dr. Pearce will actually want you to pick up some medical paper tape. You can find that right by the Band-Aids or first aid section. Basically, why he wants you to pick up paper tape is because they're going to give you these clear plastic shields, similar to what you may have had for cataract surgery. You're going to put those shields over your face and then use the tape along the shields to secure them to your face. He only needs you to wear those at night. Basically, he's just concerned if you were to itch or rub in your sleep that it would pop the incision line open. I tell people if the shields are kind of a pain in the butt, the tape's not really sticking to your face, big old safety glasses or sunglasses does just as good of a job. So if you were to reach up, at least there's a hard protective barrier in between. Last but not least, on his grocery shopping list that you'll see is eye ointment. That's an ointment that actually goes right into the eyeball. I usually recommend this for someone with pretty severe dry eye already or having symptoms of dry eye. We know that after a blepharoplasty or a ptosis, when you lift the lid, it's going to expose the eyeball more to the outside world. So you're going to have dryness initially. That's why we want you to use those teardrops. So if you're already having dry eye problems or on a prescription dry eye drop like Restasis, Zydra, Sequa, having that eye ointment would be beneficial to you. There's a couple of brands that I'll point out, Sustain Nighttime or Refresh PM. Those are 2 name brands that he'll usually say to pick up and use if needed. Again, that ointment goes right into the eye. It does make you pretty blurry, so usually I would recommend it at bedtime if you choose to pick it up. With Dr. Pearce, he does want you icing 20 minutes on, 10 minutes off, especially the first few days when we know that swelling's going to peak. The swelling peaks typically on day 2, day 3, so feel free to ice as much as you need. Most people tell me putting the ice on makes it comfortable or soothes the feeling that you're having. So again, the more that you can ice that first week for Dr. Pearce, the better. Again, with restrictions, same as what I discussed with Dr. Handler's patients, just no heavy lifting or bending for about 2 weeks. 2 weeks for swimming, 2 weeks for eye makeup, 2 weeks for contacts, unless directed otherwise by your physician. So at that 2-week mark, that's kind of when you've hit your max in terms of going back to your daily living. For Dr. Pearce as well, the nurse most likely will tell you not to get the incision line wet. That's because we do throw about 3 to 4 dissolvable sutures. We're just concerned that if you were to hop in the shower and let the water hit you for a long extended period of time, those dissolvables will dissolve faster. So that is something that I just warn people about. Give it a 48 hours or so, and it's okay to wash your hair, soap, water, all that. Just don't want the water, constantly resting on your incision lines. From that point, we usually will make your post-op appointment. That appointment is about 6 to 10 days later from your surgery date typically. So we will make sure to have that appointment scheduled before you leave the office typically. I usually am the one to see you for your first post-op. I'm going to be removing those stitches that need to come out, and I usually will give you a little half sheet or instruction on how to take care of it from there. The second post-op is typically with the physician, so you will see them one more time after your surgery if everything looks good. We basically just want to have you see me when all the bruising and swelling's there, and then once it looks good after a few weeks, then we'll have you see Dr. Pearce or Dr. Handler. One thing that's important to mention is both my physicians might make a comment during your consult about refraction changes. Basically, we know that when you lift the lid, it can actually change the shape of the eyeball. I wouldn't say going from like a -3 to a -1, but if you have astigmatism, for example, that might actually change after surgery. So we do recommend waiting at least 3 months after surgery just for your basic annual eye exam if you haven't had it already done yet. We just don't want you wasting money on a new script or them refracting you and it actually be the wrong script down the line. So that is something that patients will make a note of in the surgical packet about, why it says, hey, it might change your vision. Well, that's what we're talking about. We just don't want you going too early to get fitted for new contacts or glasses and it end up not being right. A blepharoplasty or a ptosis surgery can truly take 3 to 6 months to completely heal from, although most people, the average person shouldn't be able to tell you look like you had anything done about 3 to 4 weeks later, but it truly can take 3 to 6 months for you to heal. So we do want you to wait 3 months after surgery for those glasses checked. This surgery, again, is painless. So 3 reasons the physician would deserve a phone call in early wee hours is if it's more painful than a Tylenol, that is not normal. If the lid is completely swollen shut, that is not normal, especially the first day unilateral swelling where you can't see out of one eye. We do worry about a hematoma or a bleed. That would deserve a phone call. And then last but not least, vision changes. So any flashes, lightning bolts, looks like a curtain's coming down or a screen over your eye, that would be a retina problem that we'd be concerned about, a deeper bleed happening, that would deserve a phone call. One thing I make mention in these pre-op appointments is most people don't know a lot of ERs do not have ophthalmology on call. At least in the Metro Detroit area, the only on-call ER for ophtho is Royal Oak, Corwell now. So I just tell people I'd rather have you call the physician first, see what needs to be addressed, and if they direct you to the ER, we'll send you where you need to go. At that point too, I always tell people risk benefits alternatives, right? So this is surgery. There's risk of scarring, bleeding, bruising, infection, heaven forbid, loss of vision. But this is why we implement all those things about not taking your vitamins and supplements, NSAIDs, blood thinners, the best that we can do to basically prepare your body for the surgery to minimize that risk. Infection, we just don't see it enough to prophylactically write for any scripts or oral antibiotics. If you're concerned for infection, of course, give the office a call. We love photos. If you don't want to come in, happy to always see you. We're not trigger shy per se to call in an antibiotic if needed, but again, we just don't typically see it enough. And then, of course, anything you cut, you trade for a scar. So I do tell people this is why you're at Oculofacial Plastics. It's going to look like a white fine line at the end of the day once you're all healed up. It's truly about how you take care of yourself after surgery. As long as you follow the instructions, and especially sun protection, hat, sunglasses, putting sunscreen right on that incision line, it truly does take about a year for that pigment to fade over time into a white fine line. Other than that, when you come and see me for your discuss, I'll be happy to answer any questions or concerns you might have. I've been in the OR multiple times with both physicians, so pretty well versed of how things go down. Michelle and I are basically your point of contact from here, so if you have any questions, don't hesitate to call. I am excited for your surgery. If you have anything further that you want to discuss with me, I will see you for your pre-op. Have a great day.